If you're married and on Medicare, you don't want to miss this video. Stay tuned. Hey guys, this is Rick McDermott here with Senior Solutions Group, and we help people plan for Medicare and retirement. Thank you for taking the time to check out this video, and we're going to help you save some money and time and hassle and all that good stuff. So I've been helping people since 1995. I love helping people. We have a process where we help people. It's not one size fits all when it comes to Medicare. So a lot of people are wanting to know, what is the best Medicare option for me? So whether you choose to go the traditional Medicare route and purchase a Medicare supplement plan as well as a prescription drug plan, or if you want to investigate Medicare Part C, also known as Medicare Advantage, there is a process to make sure you're on the best plan for that as well. So it's not one size fits all. And I get asked all the time, hey Rick, should I just sign up for that plan my neighbor has, or my brother has, or my mom or dad have, or my spouse? Well, wouldn't it be more convenient to have the same plan as my spouse has? If you choose to go to the Medicare supplement route, where you have regular Medicare as your bus driver and the supplement is just a passenger on the car paying when Medicare pays, then you would maybe want to consider the same company that your spouse has, because many carriers offer a discount for couples, for married couples, to be on the same plan. So you could save some money if you go with a Medicare supplement carrier and you both have the same company. However, that may not hold true, and it probably will not hold true for your prescription drug plans. So if I was a doctor and you came to my office, I'm not a doctor by the way, and asked me, well, just put me on the same prescriptions my husband's on, would I be doing my job as your doctor, say, well, sure, why not? As a matter of fact, why don't you just take his drugs and split them up? That way you don't have to go to the pharmacy as often. And it doesn't work that way. So because prescription drug plans vary from plan to plan, from company to company, even from plan within a certain company. So one carrier can offer up to 3 prescription drug plans, standalone Part D drug plans. So Part D, D stands for drug. Part D of Medicare can be embedded in a Medicare Advantage plan, which replaces Medicare. It's a private insurance plan. It's kind of like having employer coverage for people on Medicare, where Medicare is deactivated, your Medicare card is put to sleep, so to speak, in hibernation mode, and you have a Medicare Advantage plan which pays for your hospitals, your doctors, and usually your prescription drugs. So these plans have to follow the same rules that regular Medicare Part D has. With Medicare Part D, there are usually about 24 plans depending on the state you live in. With Medicare Advantage plans, there are usually over 45 plans to pick from on average. So you can do this all yourself and sort through all the plans, call all the carriers one at a time, or you can order all the literature and lay it out on a table and try to sort through all the clutter, or you can use a website such as Medicare.gov, or you can go to the plans website. Now we have a website that we use that takes all the different plans and sorts through all of them. So in our area where we live, in Yakima County in the state of Washington, you can see all the different companies. Now this does not include the dual plans, which are for people on lower income on Medicaid. So these are all the different plans in our area. So we have United Healthcare, which AARP brands that company. We have Regents, Blue Shield. We have Aetna, which is newer to our area this year in 2023. We have another Regents plan. Health Alliance. Now Health Alliance is a local plan, and they are in our market and one other market in North Central Washington, as well as a few other states. So that's more of a regional player. It's not a national name brand company. So if you call an 800 number, a telemarketer, there's a good chance they will not offer some of these smaller companies such as Health Alliance. But they are a company we work with here in our area and do a good job actually. We love working with them. So we've got Health Alliance. Community Health is a regional plan for the state of Washington. Focus more on a lower income, more lower income people who go to certain low income clinics. Molina is another carrier. WellCare came into our area a couple years ago. And so you have all the different carriers that offer, they're in competition with each other, wanting to have you sign up for their plan. So you may be attracted to a plan by premium dollars. So what is the lowest cost plan I can get? Well, WellCare has one for 0 premium, so you don't have to pay an extra premium. You still usually have to pay your Part B, B as in boy, Medicare Part B premium, which in 2023 is $164.90. Last year it was $170 and change. It went down a little bit this year. We're expecting it to go up next year with inflation, as well as a new Alzheimer drug that is being approved by Medicare, has been approved by Medicare already. The cost is very high. We're not going to talk about that in this video. We have other videos we will be releasing in the not too distant future about this drug. So we have WellCare has 0 premium plans, and we have a plan all the way up to $153 a month. So premiums can range from 0 to $153 a month. Now, the plan that's $153 a month is not 153 times better than the plan that's 0 premium. So you don't want to base your decision based on premium dollars. You want to look at the big picture. You don't want to base your decision on bells and whistles. Does this plan offer me a robo dog or a robo cat to keep me company because my apartment doesn't allow me to have pets? You want to make sure your doctors are in network, that you're okay with an insurance company as your primary provider instead of traditional Medicare. So there's people split on both sides of the aisle here. Some people want regular Medicare and they want to buy a supplement to Medicare. Other people like saving money each month and they want to be on Medicare Advantage. Now with a Medicare Advantage plan, you're going to have an out-of-pocket maximum, where with regular Medicare, you're not. So an out-of-pocket maximum is there to protect you from a catastrophic illness wiping you out financially. So you can see the plan here has a $6,300 out-of-pocket limit. The next one down is an HMO. Now with an HMO, you must go to plan providers unless it's an emergency. So we'll have other plans that are PPOs. Now a POS, point of service plan, is in between an HMO, where you must stay in network, and a PPO, where you can go out of network. Now with a PPO, if you do go out of network, you're going to pay higher cost sharing. With a POS plan, you must you must sign up with a doctor that's in network, but you have the option of going out of network. With a PPO plan, you are not required to select a doctor. However, it is advisable to do so because the plan will usually work better if you do have a primary care physician to help coordinate your care. So we have HMOs, we have PPOs, which allow you to go out of network. So you can see United Healthcare has an AARP branded plan with a $6,500 out-of-pocket maximum with a $19 a month premium. Now, I took an actual husband and wife who came and talked to us this week, and we have their medications here. We changed their name to Larry and Sherry, however. So Larry and Sherry isn't their actual name, but we're going to use Larry and Sherry. So see this green total annual estimated cost over here on the right? What that is, that represents the total cost of what you pay for your insurance, the premium, which is $19 a month, plus your refills, so your deductibles, your co-pays, and your co-insurance for these drugs that we entered in. So we can instantly find out which plan is going to work best for you cost-wise by entering in your medications and your pharmacy, in this case, Howard's Drug, which is a local mom and pop pharmacy here in our area. So the mom and pop pharmacies are a dying breed. They usually do a great job of customer service. People love them. They love using them, but they often don't get preferred pricing. So you may pay more if you use a local pharmacy versus a big chain such as Walgreens, Walmart, Costco, Kroger, Fred Meyer, Safeway, Save-On, just to name a few. So you can see, in this case, the WellCare premium for $0 might be enticing, but for this person, Howard's drug is out of network. So you can see there's a $5,674 cost for those drugs because this person, in this case, Larry or Sherry would have to pay $5,674. We don't want to base our plan selection on monthly premium. We want to look at the total cost. So don't be enamored by a plan that looks like it's great on paper without doing your research. And if you don't have an agent, feel free to reach out to us at Senior Solutions Group. We are here to help you. If you have an agent, reach out to your agent. If you have a good agent, they'll be more than happy, if they're competent, to take the time that you need to make sure you're on the best plan. Not only today, but in the future. And by the way, if you haven't subscribed yet, please do so and help spread the word to help more people get this important information. So when we look at the total estimated cost, the United Healthcare plan comes in at $972. So when you add up all the cost of your medications, that will give us a total annual cost of $972 starting in the month of September. So when you pick a Medicare Advantage plan, here we are in August of 2023, your plan cannot take effect to the first day of the following month. So for the months of September, October, November, December, Sherry's cost will be $972. Now this is an estimate, and the majority of that cost, 896 of it, right here, 896, is her prescription refill cost. The remaining portion is the $19 a month premium. So we can compare plans side by side. We'll take 3 carriers and rate them side by side. And we'll compare those left to right. So in this case, United Healthcare, which came out on top from a dollar perspective, $972. Now in Sherry's case, her husband is on completely different medications. His best plan was the Health Alliance plan. But in her case, had she picked the same plan that he picked, she would have paid $1,000 more just for the months of September, October, November, December. So if you extrapolate that for the entire year, that's a few $1,000s a year difference. So that can make a huge impact. So we don't want to just assume that, oh, my husband's on this plan, it works good for them. Now I'm turning 65, sign me up for that same plan. If you take very few drugs, or if you're on generic drugs, that might work just great for you. But what if you're on more expensive medications? We want to take our time. We want to measure twice and cut once. You don't want to have to change your plan because you made a poor plan selection based on bad advice, or if you weren't taking the time to do this properly. And it can be very overwhelming. We want to take the pressure, and we do take the pressure off of our clients. That's why it's a good idea to have an agent. And it can be any agent that you work with that you feel good about, that you feel comfortable with. You might want to call 2 or 3 different agencies or agents, whether it's a local agent or a national agent. You know, just listen to your gut, and if you feel like you hit it off, and not only that, you feel like they have your best interest at mind, then feel free to use that agent. Again, we're more than happy to adopt you. We love taking care of our clients. We have clients we've helped for years and years and years and years and years, and they rely on us, and we love them, and they're like our parents. We love our clients. So, in this case, United Healthcare would come out better than Health Alliance. But in Larry's case, Health Alliance for $0 premium has a $554 out-of-pocket estimated annual cost, where the United Healthcare, we've got to go all the way down to the middle of the pack, and then we can compare that to the WellCare plan for $12 a month and compare those side by side. Now in Larry's case, he is better off going with Health Alliance because you can see the cost here is $554 versus $31.79. Now, if he was on the WellCare plan, he would definitely have to change pharmacies. So he wouldn't be able to keep Howard's Drugs as his pharmacy. So now we can compare the plan and find out what is it that's going to cost him the most for his medications. And it's the Repatha injectable right here for $47. Now, one thing you got to be aware of, if you're ever on an expensive medication, it might start out at $47 for the first few months of the year, and then it might jump up to 25% cost sharing midway through the year. That's due to the donut hole. So once the total cost of your drugs equal $4,660 in 2023, and it's going to go up to over $5,000 in 2024, then you're going to have to pay 25% of the cost of your drugs until 2025, when everyone will have a $2,000 maximum out of pocket for their Medicare prescription drug cost. Now you can also use mail order as an option. With mail order, you can get drugs 3 months at a time mailed directly to you. So that might be an option for a lot of people that like the convenience of having their drugs mailed straight to them. Those of you who like to look your pharmacist eyeball to eyeball, and you like the local pharmacy, then you might want to stick with a local mom and pop pharmacy if you don't like the long lines at some of these chain pharmacies. Now, what if you decided, I don't want Medicare Advantage, I'd rather have regular Medicare and a supplement? So then we can decide, okay, let's look at these 24 different prescription drug plans, which are standalone drug plans, to go with regular Medicare. Now, in Larry's case, the best premium would actually be $113 a month for a total cost of $17.93. So he's going to actually save money by joining the Medicare Advantage plan. Now, he may pay more out-of-pocket costs for health care on his Medicare Advantage plan, and he has to provide a in-network doctor to the plan, and he can go out of network, but he's going to pay a higher cost share if he does go out of network. With regular Medicare, you can go to any doctor that accepts Medicare nationwide, and you can pick a standardized Medicare supplement plan that never changes from year to year. Now, you're going to pay a higher monthly premium, but that's the price you pay for certainty of knowing you can go to any doctor that accepts regular Medicare. Now, the Medicare supplement plans don't cover the extra benefits like vision, dental. Sometimes they'll cover a gym membership, but they don't cover over-the-counter products. They're not going to try to lure you in with extra benefits. What they're going to offer you is peace of mind of knowing that if I go to the hospital, I go to the doctor, I'm not going to have to worry about having to pay thousands of dollars out of pocket, potentially like worst case scenario I could with Medicare Advantage. So in this case, the Assurus plan would give him the lowest total estimated cost at $1,793, followed by ClearSpring at $2,048, Aetna at $2,068. So you can see the further down the list we go, the more he's going to pay out of pocket until we get down to $8,663 with WellCare that doesn't contract with Howard's Drugs. Now, in Sherry's case, if she were to go with a standalone drug plan, not Medicare Advantage, her best option would be Assurus as well. Now, that is a higher monthly premium, so they may want to consider changing their pharmacy to Safeway or not, or another pharmacy. So we have the ability to change pharmacies. So in Larry's case, if he decided to add a different pharmacy, it might change the plan lineup. So there's a lot of factors involved when you're picking out a Medicare prescription drug plan or a Medicare Advantage plan, and it can change from year to year. So don't just settle in and get cozy with your plan, because in the fall, you're going to get a letter from your plan that you do not want to ignore. It's required by law. It's called the Annual Notice of Change letter. So each year, your plan is required by law to get this to you before the end of September. Don't throw it away. I know you get lots of junk mail, but you want to save these and you want to review your plan, especially if you're on expensive medications, brand name drugs like Eliquis, Xarelto, inhalers. So make sure you take the time, whether you do it on your own or if you have an agent, to review your drug plan and your Medicare Advantage plan. Now your supplement insurance, your Medigap, also known as Medigap, they'll raise your rate usually once a year, 5, maybe even 10%, sometimes 11%. If that's the case, you may be able to change your supplement plan based on your existing health. Now in our state of Washington, if you're on a Medicare supplement plan, as long as it's not the basic plan A, Medigap plan A, you can change to any plan year-round and save money. So you're not held captive to the higher premiums. But in most other states, if you have a rate increase, if you're not new to Medicare, or if you're not in a state that has a birthday rule where you can change during your birthday month or an anniversary month, so in the state of Missouri, you can change your Medicare supplement plan during your anniversary of your policy. So if you're in a state that doesn't allow you to change your Medicare supplement plan, you're going to probably have to answer health questions. So for some people, if they're on a tight budget, they may end up going with a Medicare Advantage plan because Medicare supplement insurance may become a little bit too much for their budget, or maybe a lot too much for their budget. Again, it's not one size fits all. If you found this video helpful at all or educational, again, please share it with a friend and reach out to us. We're here for you. We don't require anyone to become a client. As a matter of fact, even if you just have a question or two, you need us to help answer those questions. We may not have the answer, but we'll get back to you with that answer. Again, thank you so much for taking the time to watch this video, and have a great rest of your day.